Okay, I have not given a talk with people in the flesh for a very long time. We are completely remote. Nobody likes to see each other in Toronto or anywhere much in Canada. So I'm here, and Ed told me to walk around, and I don't think I'm going to walk around, but if I wander off, just bring me back. Okay, so I think, is that working? Yeah. I just have a few conflicts or declarations of interest. My spouse receives income from a scholarly peer review management company. He runs or has previously run many different journals and editorial offices. I have some academic competing interests, I guess you'd call this. I have a fellowship from the Canadian Institutes of Health Research, and I'm also a fellow with ASAP Bio, which is a preprint advocacy organization. So today we're going to define preprints, describe some of their features, understand the benefits and risks of including preprints in systematic reviews, current evidence on preprints in systematic reviews, and identify some approaches for integrating preprints into review workflows. So preprints are scientific manuscripts which are uploaded by authors to public servers, and they're not yet published in journals. And you're going to know a very distinct difference between a definition by ASAP Bio and one that others use, and I'll go into that a little bit later, but it's typically people say preprints are not peer-reviewed, and this organization takes a different stance because preprints can be peer-reviewed and then uploaded to a preprint server. So some of the key features of preprints is that they're free to access. They're used to rapidly disseminate research and also for others to provide early feedback on research. So some of the common servers for biomedical preprints are bioRxiv, medRxiv, and these two servers were recently have a new home with a group called Open Archive. That's the platform which they're hosted under. You may have heard of others. There's verRxiv, which is a preprint server from the Gates Foundation. This is quite new, and they're doing something quite innovative with some research integrity checks. There's Research Square, and then I wanted to mention this F1000, which is not quite a preprint server. You may have heard of F1000 as a journal, but what they do is pretty much the preprint model. They take research that is submitted, they do some checks, and then they post it online, and then that research is peer-reviewed, so it's public. It gets a DOI, and then peer reviewers can add comments. They don't all get peer-reviewed, and then sometimes they get transitioned to a publication if there's peer review and then an acceptance. So that's pretty much how the model works. So just to give you an overview of the history of scientific publishing and preprints, scientific publishing sort of originated in the 17th century. 1665 is a notable date for this journal, the Royal, I can't remember the name of it. Does anyone know what this journal looks like? This is the Philosophical Transactions of the Royal Society, maybe, and then another journal, French journal. So the model pretty much existed like this, which was the editor of the journal paid to publish the research and paid to distribute the research. And that kind of existed for quite a long time until the 20th century, and things started to change. And really this changed with post-war uptick in science. And so in the 1960s, the first preprints actually, there's some evidence that these were the first preprints from the NIH. And so they had these exchange groups to have biology research, which wasn't yet published, shared amongst researchers who were in these groups. And then very quickly, journals decided they didn't like that. And if you know, does anyone know who this person is? Probably not. You may have heard of or may not have the Ingelfinger rule. So the this is, I can't remember his first name, or maybe Henry. It looks like a Henry. So basically, he is the editor of the New England Journal at the time. And in the 60s decided that any research that had previously been shared was not fit for publication. And a lot of journals kind of adopted this rule, and it's still known today as the Ingelfinger rule. And things have certainly changed, but that was a very long-standing practice. So preprints sort of went away in biomedicine then. And then we had this modern peer review, the idea of the editor reviewing the research solo sort of didn't fly anymore, and research started getting sent out because there was so much of it. It was overwhelming for just the editor. It started to be sent out to others to review. And then that became sort of the model of modern peer review. And a lot of publishers sort of took that, and that became the new model. And then we had in the 90s, the internet came along, and we had digitalization. And the first preprint server was arXiv, which is in physics. And so that model kind of ticked along for a long time, and no one else really was into preprints. But physicists, even till this day, really enjoy that sharing of research, and it's a pretty normal practice. In the 2000s, we had open access came along as a journal model, and that changed things a lot. So open access is where instead of paying to read the research, authors, a lot of the time authors pay to publish, and then you can read the research for free. And so that kind of convinced people that we needed a model where it was free to access. And so more preprint servers started to come along. So bioRxiv in the 2010s, OSF, medRxiv, which was quite new. And then, of course, in the 2020s, there was COVID impacts on publishing and preprints. So before preprints, the way that it kind of worked, you might know this, you would submit to a journal, maybe get rejected, go to another journal, and then maybe you get some revisions and then eventually get rejected, and then a third journal, you get accepted, finally after a few peer reviews. And this process can take months to years. In biomedicine, it's like a 4 to 18-month process. And then, of course, journals like to collect money for the research that's published there. So either you're paying to read at the journal or you're paying to publish as an author. So just a few differences from journals and preprints. So journals have this mandatory peer review process, which we know of. And then preprints may be reviewed, but they're not necessarily reviewed. But they may be reviewed by third-party platforms. I'm trying to remember some of them. Pre-review is one. Another is PubPeer. You may have heard of some of these. MetaRoar, I believe, is another. It's a preprint peer review for meta research preprints. Okay, so it's very meta, what's happening. Citations, so journal articles are cited, and those count towards metrics. Preprints are increasingly being cited, and they're counting for some sort of credit, but it's kind of unknown how they're being counted by institutions, funders, and otherwise. So you might have heard of DORA, the Declaration on Research Assessment. So that's been like adopted quite widely now, and one of the principles is that we need to diversify how we're measuring people, not just through publications. And so access, so again, journals might be behind a paywall or maybe freely accessible. Preprint servers are always freely accessible, typically. The version is usually in a journal, you'll find the final version, unless you're looking at, say, F1000. Or in preprints, you can have, authors can upload their own manuscripts, and there's a whole version control. There may be like up to 30 preprints of the same article. So there's a lot of versioning, but that's all tracked using DOIs. Then the purpose of a published article is to disseminate vetted research findings, which we think conveys some sort of trustworthiness of the research. Not sure that's true, but with preprints, the idea is to rapidly share research, get some feedback, and often to make a priority claim because it does take so long to get published. For the publication status, articles are considered published after journal peer review, and if they're published in a journal. Preprints may or may not ever be published, and we'll go into a little bit more of that after. And then both journals and preprints are a permanent record, depending on the server, but for most servers, they issue DOIs, which are dates of issue, and that is a permanent record. The publication cost can be high for an ABC, or it may cost, of course, to read the article, but preprint servers are free to post, so no cost to authors. So you can see that because of this removal of the barrier of cost, they're more accessible to people who can't necessarily get published or can't afford to get published. Preprint servers might foster a little bit more equity and wider publication. So, preprints and peer review. So, there was this article last year, a study last year that was published about public understanding of preprints and how do audiences make sense of unreviewed research in the news. And the question asked was, when you see the term preprint in a news article, what do you interpret it to mean? But then we had this post from Hilda Bastian, and I think some people, I quite agree with this, but the idea is that preprints themselves are not a marker of quality, neither is a journal article, and what we really need to be asking is, what do you interpret a preprint article to infer? Does it convey credibility like a journal article, and should we be assessing the article rather than the source? So just moving on to systematic reviews and some considerations. We think of timeliness and rigor. When I think of systematic reviews can take 6 to 24 months to be completed and to be published. They risk being outdated on publication because it does take so long often to publish. Living reviews attempt to bridge the gap with continuous searching. And the idea of all available evidence, what does that mean? So some of the benefits of including preprints is that we might have faster access to new findings. And then also there may be some reduction in publication bias. There may be findings that would not otherwise be published in a journal that are found in preprint server. Preprints have the ability to possibly foster equity. I mentioned there's a lower barrier to entry. So that may mean more people from different regions of the world can publish in them, or early career researchers. And they have the potential to strengthen the evidence base. Some of the risks and challenges are the lack of peer review, or the perceived effects of lack of peer review, potential misinformation or errors, which I'd say exist within journal articles as well, and tracking versions and duplicate publications. So there's an idea that I mentioned these multiple versions of preprints, and then also they sometimes transition into a journal article, and those can look a little bit different than the preprint, so how do we keep track of that? And some ethical considerations of research that could be potentially dangerous or high risk being published in a preprint or put in a preprint server. And we saw some of this during COVID with some research that maybe could have been considered harmful and then shared in a preprint server and then abused maybe a bit by others. So in COVID, this is where I think we all really understood what preprints were. We had a very rapidly evolving evidence base, and preprints were really instrumental in sharing research. There were 97 living systematic reviews on COVID, and many of them included preprints. And you can see here, this is a review that was used to inform the WHO guidelines, and you can see just how many preprints and patients were included in those preprints. So this is the living guideline for COVID. And so the evidence shows that about 70% of preprints are eventually published. 77% of COVID preprints become published, whereas pre-COVID, only 67% of preprints were published. So it's a bit of a difference there. And then there seem to be a few major changes from preprint to publication. So a lot of research has looked at corresponding preprint and publication pairs. So we found similar reporting quality between preprints and corresponding publications. There's a minimally higher risk of bias in preprints compared to published articles. And preprints tend to be smaller studies. So again, the idea that some research is not published, but they appear to have similar effect estimates to published research. And so we don't know too much about the value of medical preprints beyond COVID. So most of the clinical research that is preprinted has only become recently available as preprints, because that model certainly wasn't embraced for a long time due to journal hesitation. And then there was really a coincidence between medRxiv launching, which was June 2019, and COVID, which happened started in January 2020. And so we don't really know too much about clinical research pre-COVID. medRxiv saw quite rapid growth, 63,000 records in the first 5 years, compared to the first 5 years of bioRxiv, which is established quite a few years. I think 2013 it was established. We saw about 50,000 records. So I think COVID really prompted a lot of deposits of preprints of clinical research. But then you can see that there's been quite a shift in medical research, whereas in COVID, about 60% of the literature in medRxiv was COVID-related. That's now reduced to about 35%. So there's quite a lot of other research that we know very little about. Oh, I have an animation. Okay. And so the point of that was that preprints are underexplored beyond COVID. So we know very little about publication patterns, the equity gaps in scientific publishing. I mentioned that some of these, so women, racialized authors and groups they lead research, published research far less. Authors from low and middle income countries, they're published far less than others. And then of course there are some findings that are underrepresented as well, so null and negative findings. And then we know little about the quality and trustworthiness of preprints. So preprint research agenda. So this is my research agenda. So I'm interested to know who authors medical preprints and how this differs between COVID and non-COVID preprints, which preprints are more likely to be published, and do preprints share the same trustworthiness as published articles. And so we have a team of researchers. We submitted a grant recently, and we're having developing a protocol to be published soon. So this is just a light framework, I'd say, for preprints and evidence synthesis. And I'm basing this, although I haven't done that research yet, but I'm really basing this on my understanding and the work done on predatory journals, which we found that a lot of real research is contained in predatory journals, and there's no need to judge the source, as in the journal. We really need to have a look at the research, and I'd say the same applies to preprints. So here, in terms of steps of systematic reviews, here's some recommendations. Identify, so you decide at first whether or not to include preprints. So that might be because there's a rapidly evolving evidence base. You might have limited available evidence, and they may just be a source of great literature that you're interested in pursuing. Screen, so define criteria for preprints at the outset, and keep that criteria for inclusion the same as published research. Again, no real difference to distinguish the two at this point. Appraise the research, so treat it like any other study, apply standard risk of bias tools, and then this concept of trustworthiness is interesting. So the idea is that not just preprints, but a lot of journal published research. Now we're starting to question what a lot of that looks like. We've seen an increase in retractions. What does this all mean? There's misinformation. We're not sure how trustworthy research is anymore. And so there are some new tools being developed, and one of them is called TRACT, Trustworthiness Tools for Clinical Trials. And then, of course, there's some other indicators, so reproducibility indicators, we call this, so the availability of protocols, which really help us to understand how reproducible, or whether or not something is reproducible. Is that protocol registered? Are there data and code available? And then, of course, we can track the published version of preprints, so some servers will track that for you. Then you can also go to some different databases and do some searches for that as well. And so this is just a checklist that I'm using in my research to assess the trustworthiness of preprint research, or trials that are published as preprints. And this is just an idea of some of the items on that checklist. And basically, this is still under development. This checklist has been developed, and now they're doing some appraisals on its effectiveness. And actually, there's some use of AI, and they're testing whether or not we can do some of this appraisal using AI technology. And then, again, integrating, so treat this just like published research. One idea is to carry out sensitivity analysis if desired, and this would really help people who are doing meta-research like me to understand the differences between preprints and published research. You would obviously transparently report the publication status of preprints and not preprints, and then again, recheck or check the publication status of a preprint before publishing your review. So in terms of appraising preprints, I think this is a replication of a slide that I already presented, so we'll just slide past that. Institutional and journal policies, and I think this should also say funders, because funders are increasingly supporting the use of preprints, and they're increasingly recommending preprints. So not only are they saying you can submit preprints in your applications on your CV, but you can also submit preprints, research to preprint servers. The Gates Foundation have, one of the largest charitable foundations in the world, have recently launched their own preprint server. They're doing some integrity checks on that. They're also introducing this idea of badges. So if articles, preprints meet certain criteria, they get badges in several different areas. It's a neat model. There's increase in support from journals from preprints. A lot of that's due to COVID. A lot of journals said, yes, of course, we'll take preprints. We'll consider research previously published in journals. And some journals have walked that back, but it still does exist, and there's more work to do here. And then some systematic review organizations have said, yes, of course, we'll consider including preprints in reviews. That's a no-brainer. And so, just to be careful about how, be a little more cautious about how we're doing that. And of course, the appraisals that I mentioned. So some emerging frontiers. This research integrity check, I mentioned the badging. Badging has been on the table for a while, and this is the kind of thing that just takes a lot of effort, a lot of human input. Research integrity and AI is like a little bit of a question mark. Can we really assess that using AI? AI for preprint screening, I'd say this is not just a preprint consideration, but really journals are toying with the idea, can we vet research, can we peer review using AI? A lot of people are trying to do it. I'm not sure the effect of that yet. There's open peer review overlays. I don't know if folks have heard of an overlay journal, but there are some journals that purely exist just to kind of compile a research that's been published or posted in preprint server, and then that content is curated into a journal or an issue. So that's that idea. And then preprints as a mechanism for increasing equity in publishing. So low and middle income country studies are now maybe more eligible for dissemination through preprints.